It doesn't hurt, and it certainly helps people.
Once you have one good experience with it, just make it a part of your every other month schedule.
For many, donating blood is just what they do.
As often as I can.
And for some, like Gary Wayne Matthews, who's donated more than 300 times, donating blood is simply a way of life.
I help people. Doesn't hurt me, but it helps people to receive the blood.
And now the American Red Cross is doing more with the blood that is donated.
That's why this is so important for the public to understand that when they donate blood, they're not only helping the patients in our community that have conditions that require blood, they could potentially be helping someone that's still in the throes of battling this awful virus.
Every unit of blood donated,
We're testing all blood donations for COVID-19 antibodies.
if the first test comes back positive,
That blood is going to go through a second testing process.
a second positive can then fast track it to a local hospital.
It is now possible to potentially take that blood and redistribute the plasma to it to a patient who's battling this virus.
For COVID-19 patients in the hospital,
But now we're using plasma from patients who have recovered from COVID to be able to transfer that immunity to patients who now are newly diagnosed or newly infected with COVID.
and that can be life-changing.
Patients who receive it earlier in their infection tend to have better outcomes, shorter lengths of stay.
Using plasma with antibodies isn't new.
We've also more recently used it to treat MERS, SARS, and Ebola virus.
And goes to work immediately.
So you can actually give someone and transfer your immunity by providing your COVID plasma.
For blood donors like Meredith Martin,
It's just such a small thing that we can do. It probably took me 20 total minutes from arriving to now.
You know, some people can have it and not know, and don't have any symptoms or anything. And then if you find out that you have had it by the test that they've given you, I think it's a great idea, and I would jump at the chance to help by donating.
I think it's wonderful. I think anything the Red Cross can do to help those in need is great, so I back that 100%.
the key now is getting blood donors in these seats.
About 2% of our nation's donors are positive for the antibodies and do have the ability to transfer immunity for a patient suffering with COVID.
If you've tried to donate blood in the past but were turned away, know now that the FDA has relaxed its requirements. If you served in the military in the 80s and 90s in Europe, you can now donate. If 3 months have passed since your last tattoo or blood transfusion, you can now donate. But the Red Cross wants to remind everyone that COVID-19 has not slowed down the daily need for blood donations. That's a look inside Wayne's World. I'm Wayne Colville, CBS 6 News.